Hi, this is Dr. Beldholm, and in this video we're going to talk about the recovery from lower torso operations post weight loss. It's a video that's an overview video of the recovery of a whole range of different operations. I have actually done separate videos for separate and more in-depth for each of the operations. Now, what's the lower torso? Well, it's the lower abdomen, flanks and back area, and it's a very common area to get loose skin in patients with post-weight loss, either from bariatric surgery or from medication loss or lifestyle changes. Obviously, that can also happen. Now, I'll go through recovery for hospital stay, timelines, aftercare and possible challenges that you might have. And again, this is an overview video rather than being very specific on one procedure. It's very important that you do know the recovery so you can plan, how much time off work, how much time off living, when you can start driving, when you need help to recover, and all those other things that are part of the recovery process. And the operations that are part of the abdomen are abdominoplasty, circumferential abdominoplasty, fleur-de-lis. These are all the front ones. We may also do a apronectomy or lower abdominal lipectomy, upper lipectomy, circumferential lipectomy, belt lipectomy, or 360-degree abdominoplasty are also part of those operations, and that's all the way around the abdomen. And then the final one would be a back lipectomy or gluteoplasty or buttock lift, also referred to as a buttock lift. So that's really a whole range of different ones. Recovery is really important stage in the surgical journey because you have the actual operation, which tend to range from about 3 hours to can be up to 8 to 10 hours depending on how much we include in that operation. And healing and recovery is really important for your final result. I'm also going to go through the return to work, exercise and daily activities. Now, the hospital stay, I operate mainly in Maitland Private Hospital. Most of these operations would have at least one night in hospital, but for bigger operations and combined operations, you're looking at 2 to 4 days in hospital. And if you do need more, then you're going to just stay until you recover fully and you can get out of bed and you're not dizzy and all these things that can happen straight after the operation. The focus in the hospital is to monitor you, make sure there's no complication, pain management and wound care. The early recovery, you will be wearing a compression garment and usually a wraparound garment around the tummy, and that's worn for 4 weeks full time and then another 2 weeks half time. You can take it off for a shower, going to the toilet and those things. I usually use pico dressings. They're suction dressings or negative pressure dressings. They sit on the wound. There's a little box that sucks on the dressing to create a negative pressure and better wound healing. We usually change that in the office at day 7. The other dressings I like is the Comfield dressing, which is a nice soft dressing, a jelly dressing, and I tend to use those in folds, sort of back area or underneath the breast, or where it's a little bit difficult to put on the pico dressing. Let's go through the days of recovery for most of these operations. So day 1, you're usually monitored in hospital. You have pain management, wound checks. I try to get you out of bed. If we done a really long operation, there's a lot of patients that get blood pressure issues the next day. So hypotension, dizziness, a little bit difficult getting out of bed. So day 1 tends to be a little bit more on the difficult side. And if you've had a long anesthetic, then nausea, vomiting and those things can also happen in the first day. Day 2 is usually significantly better than day 1. If you've had a lot of hypotension, dizziness, difficulty getting out of bed, usually day 2 does tend to resolve. Sometimes it takes to the afternoon or day 2 for those to resolve. You can finally get up out of bed, mobilize a bit, and you tend to feel a lot better on that day 2. If you haven't gone home on day 2, then day 3 to 4 tends to be the one that you go home. There's going to be significant amount of swelling. If we've done especially liposuction or suction-assisted lipectomy, then there's going to be a lot of bruising, most likely as well in those areas. You'll find that the areas that we do liposuction on tend to be a little bit more sore than the other areas. So especially when lying on those areas. Day 4, usually there's reasonable mobility. You're up out of bed, you're walking around. Depending on the operation, you will have drains. Most of the operations for body contouring after weight loss do have drains. They tend to come out the first 4 days. So usually once you get to day 4, some of the drains are out. You may still have 1 or 2 drains left to be taken out. And sometimes we have to send you home with drains, and we take those out in the office. And that's not a big deal. A lot of people go home with drains. I prefer to keep the drain in if it's draining more than 20 cc's, so 20 mils of fluid per 24 hours. Because again, you don't want that fluid to accumulate or cause a seroma and issues afterwards. So sometimes the drain stays in for 5-7 days. That's not the common thing, but that is something that you may have happened. The first 2 weeks tend to be the most critical part of your recovery. So the initial period will be in hospital, and then you'll come to the office to get wound care, drains, pico dressings change, all the other things we do in the office. And that's a critical period, because if you get seromas, fluid collections, hematomas, infections, breakdowns, we want to make sure that we catch those early so we can put you on antibiotics, we can drain any seromas, we can do dressing changes, we can take care of those things for you. And that 2-week period tends to be when all the intense treatments are happening. If everything's fine and you've healed up and the wound looks good, then the next follow-up will be at the 4-week mark with me we'll do some repeat photos. I have a look at the incisions. We start silicone strips, which tend to help with scarring. But if you have a wound breakdown or if you have other issues, we just keep seeing you in the office, and my nurse and me will take care of you until we get those things resolved. Generally, for most of these operations, abdominoplasty, circumferential, fleur-de-lis, etc., driving tends to be around the 2-week mark. If you're having a smaller operation, let's say we're just doing an apronectomy or a limited abdominoplasty or something like that, you may be able to drive at 1 week to 10 days, but that's unusual. So usually it's around the 2-week mark. And depending on what sort of work you do as well, if you're doing work from home, so you're working on a computer, the main thing there is that you need to be off, obviously, your heavy-duty pain relief, because that's not compatible with making decisions and working. So usually that's 1 week to 10 days. So you can kind of expect that time frame for rest and recuperation. Exercise-wise, we're getting you out of bed as soon as possible after the operation. However, being comfortable walking a reasonable pace, you're looking at that 2-week mark. And then after 2 weeks, you can start building up your exercise. Getting back to completely normal, doing everything you did before the operation, you're looking at about 3 months. So it's a gradual process. So for 4 weeks to 3 months, it's a really gradual process of getting better and better and better every day. If we're looking at the final result from the operation, then you're looking more like 12 to 18 months, because there's usually initially significant amount of swelling. That swelling tends to take time to settle, so you're not going to see the final result until that year mark. And also the scars are going to be really red and angry looking for up to 6 months. And then after 6 months, they start gradually fading, and scars can mature up to 2 years after the operation. So that's quite a long time frame, but certainly you'll have significant improvement, but it does take time for everything to settle down. You will see me in the office at 1 month, 3, 6, and 12 months. Now, a lot of the patients that come and see me come from quite far away, so we usually organize Zoom calls for 1 or 2 of those follow-up visits. However, I do want you to come and see me at least once or twice for 6 to 12 months after, so that we can do the proper professional grade photos for you, so that you get proper before and after photos. Once you see me, we also give you the before and after photos. A lot of patients have their operation filmed, so we give you those videos as well. Again, it depends on completely what you want. Potential challenges are usually wound healing problems, infections, fluid collections, and potential blood clots. So those are things that we look out for. Larger operations will obviously take longer to recover from. So anything from the front, so an abdominoplasty, that we're taking skin from the bottom, and no muscle repair is probably the one that has the quickest recovery, and then we add things on top. So then we have abdominoplasty plus muscle repair, abdominoplasty plus liposuction or suction-assisted lipectomy and muscle repair, fleur-de-lis cutting in the vertical sense and the bottom, circumferential, doing upper lipectomy. So each of these add more pain and discomfort for the recovery and a little bit longer recovery. So the last couple of years I've been doing a lot of combined operations as well. So we're doing, for example, fleur-de-lis with a upper abdominal lipectomy with a breast lift or mastopexy as part of that, or we're doing an abdominoplasty with arm lift, or we're doing arm lift brachioplasty, or we're doing a circumferential with liposuction or suction-assisted lipectomy on the thighs, and on and on and on. So it really is very, very customized to your body and the way that you have your loose skin or the result that you want to have. So that's an overview of the post-weight loss lower trunk operations. I hope you find this useful. I'll certainly go through a lot more detail when you come and see me in the rooms. Make sure you do the online booking and come and see me, and I'll see you in the next video.